Hi, my name is Stephen Owlett. I currently work with the College of Business here at Westcliff University. My main area of interest is the use of artificial intelligence in genetic engineering. Recently, I had the opportunity to complete the Westcliff University Fellowship Program and publish a study in the South Florida Journal of Development entitled Life Expectancy Disparities in Florida, a quantitative analysis of two counties. Today, I would like to share with you the results of this study and the findings. First, a little background on the study. Despite substantial increases in healthcare spending in the United States, healthcare outcomes for low socioeconomic populations remain lower than those of the public. This disparity is significantly influenced by the social determinants of health, such as income, education, and the environment. This quantitative comparative study delves into the influence of social determinants of health on the life expectancy gap between two Florida counties. Collier County, which has the highest life expectancy in Florida of about 87 years, and Marion County, which has one of the lowest life expectancies in Florida of about 77 years. Both counties are similar in population size. Examining these two contrasting counties aims to identify how social determinants of health contribute to this disparity. In 2022, approximately 240,000 individuals died in Florida, of which 179,000 or 75% were from internal causes of death, and 60,000 or 25% were from external causes of death. Internal causes of death are considered a death caused solely by disease or natural processes inside the body, such as chronic diseases, and external causes of death take place outside the body, like accidents, violence, suicide, drug overdoses, etc. Another term important to the study is what's called premature mortality. This is defined as death before the age of 75. The first challenge of this study was finding a conceptual or theoretical model that I could use to compare results. Before getting into the methodology and findings, I would like to discuss what was involved with this process. Several models were considered for this study. The Area Deprivation Index by SIN and extended by kind focused on socially disadvantaged and differing dimensions of poverty. The North Carolina Institute of Public Health and the Carolinas Health System developed a conceptual model driven by the Social Determinants of Health Index that includes additional dimensions of health-related social needs such as food accessibility. However, this model has not been validated against actual health outcomes. Other conceptual frameworks examined include the World Health Organization's framework, the Rural Community Health Wellbeing Framework, the Public Framework for Reducing Health Inequities by the Bay Regional Health Inequities Initiative, Healthy People 2020, the Kaiser Family Foundation, and the Yoder Framework. Each of these frameworks focus on the social determinants of health and do not attempt to connect life expectancy directly to their model. Because of the similarity of purpose in each model, a conceptual framework was developed. You can see this model on your screen right now, and provides the basis for the factors used to identify the broad categories and components that influence life expectancy. A couple things with this model to keep in mind is that they interact with each other, and individual behaviors influence health outcomes. The influence of social health outcomes on chronic diseases and symptom experiences of patients with a chronic condition. Chronic diseases are caused by social determinants of health or genetics, can further limit a person's ability to manage their health and environment, increasing vulnerability to external death sources. Social determinants of health can influence how genes are expressed, making some individuals more susceptible to chronic diseases, even with the same genetic predisposition. Once the model was built, the next step was the research questions, methodology, and data collection. Two research questions were identified. The first, based on the current research. The first was, how do social determinants of health factors differ between the two Florida counties, Collier and Marion? and how much do social determinants of health factors influence both counties' internal and external life expectancy outcomes. The data profile for Collier and Marion counties were built from the following publicly available data sources: the 2022 County Health Rankings and Roadmaps from the University of Wisconsin's Public Health Center Institute, the Florida Health Charts from the Florida Department of Health, the U.S. Census Bureau. The latest published data from the health needs assessments from both counties was used to provide context. The analysis delves into three key areas: demographics, social determinants of health, and their influence on internal and external factors of death and longevity. Demographic data for Collier and Marion counties and the Florida averages were collected from the University of Wisconsin Public Health Score and converted to Z-scores. Linear regression was employed to understand the relationship between these demographic variables and assess model strength. The Z-scores from the latest internal and external death data from Florida charts was used in a linear regression model to determine how social determinants of health from each county influences potential years of life lost. This approach aims to reveal how demographic characteristics and social determinants of health impact the life expectancy between both counties. So let's continue and take a look at some of the results. I know there's a lot of data on this chart, and I'll hit the highlights. Research question 1, how do social determinants of health and demographic factors differ between the two Florida counties, Collier and Marion? This part of the analysis examined demographic influence of chronic diseases risk in Collier and Marion County, Florida, revealing significant disparities. Differences between both counties include demographics. Collier County boasts a higher median income and more diverse population and more significant concentration of residents between 19 and 65 years of age. Conversely, Marion County skews younger with a lower median income and less diversity. Social determinants of health. Marion County suffers from considerable worse health outcomes across various categories. This includes higher rate of premature death, obesity, unemployment compared to Collier County. The analysis finds a statistically significant correlation between social determinants of health in Marion County and the likelihood of chronic disease. The data from Census Bureau was converted into Z-score and the differences identified. You can see this in the next slide here. And once again, there's a lot of data on this slide, and it's going to be available for you to review, towards the end. The comparative analysis highlights several critical social determinants of health with substantial differences between the county. Marion has a higher premature death rate, less than 75 years old, poor physical and mental health, lower birth rate, higher adult smoking and obesity rates, greater unemployment, and more injury deaths than Collier County. Social determinants of health are interconnected, forming a complex web that can impact a person's life expectancy. The study illustrates the interconnectedness of what I would term as a causal domino effect. For example, low-income status individuals have limited healthy food, quality care that can lead to poor physical and mental health, manifesting in a poor physical and mental health days. Poor physical and mental health, as chronic conditions like obesity can result in chronic conditions like obesity and mental health issues, hinder employment opportunities. In turn, financial strain can worsen mental health and limit access to healthy food, which increases the risk of obesity, smoking, and poor mental health days. Poor health services, stress and financial strain can lead to unhealthy coping mechanisms like smoking, overeating, etc. And health consequences, obesity, smoking, and overall health all increase the risk of chronic diseases and premature death. And, when it comes to pregnancy, all these factors discussed, poor maternal health and nutrition can lead to lower birth rate babies, and the cycle starts repeating itself. Each factor can worsen the other, creating a downward spiral. And, once you're in that downward spiral, it's very hard to correct it and get yourself back on track. Now on to research question 2. How much do social determinants of health factors influence both counties' internal and external life expectancy outcomes? The first step was gathering and analyzing information from both counties from Florida Health Chart. There were over 360 potential causes of death. An analysis found that the top 30 causes of internal death and the top 5 causes of external death account for nearly 90% of the total death rates for each county. These causes were used for further analysis. The time involved with analyzing all causes would have added unneeded complexity at this time for the analysis. Data was validated and converted to z-scores based on total years of life lost. Multiple linear regressions analyze the influence of social determinants of health in internal and external factors. Regression coefficients are compared, across counties to identify factors with substantial impact. There are a couple interesting things to note. The percentage of total deaths in the top 30 was 53.2%, and top 30 internal death rates were 53.2% and 56.2% in Marion County. The percentage of total deaths for the top 5 external was 33.8, bringing it up close to 90% of total death rate in both counties. Now let's discuss research question 2. How much do social determinant of health factors influence both counties' internal and external life expectancy outcome? Linear regression was used, to answer this question. You can see the RQ dashboard on your screen. There's a lot of data. I'm going to explain it just very briefly here. Years of potential life loss was used to help provide a clear picture of premature death before the age of 75. R squared and standard error of estimates were statistical used to assess how well the models explain data variations. A high R square indicates a better fit. A lower a standard area of estimate reflects less variation. Collier County showed more substantial explanatory power with an R square of 0.740 and then Collier's with an R square of 0.468. The Collier County model suggests a more significant explanatory power of social determinants of health on life expectancy. This means that social determinants of health are more likely to play a more prominent role in shaping life expectancy in Collier. Regarding external life expectancy, this delve into the connection between social determinants of health and years of potential life lost. The results are promising but inconclusive. The analysis revealed a strong positive correlation between social determinants of health and years of potential life lost in both counties. Collier model showed an R square of 0.746. Marion showed an even higher one at 0.915. However, there is a catch. Statistically significant P levels, typically below 0.05, were not achieved for the F-test statistic in either county. This suggests that the models need more data or refinement to draw conclusions. Co-founders were identified with hereditary, genetics, and lifestyle. Those are areas that need further explanation. To summarize the findings, there's significant correlation between social determinants of health and internal causes of death. Social determinants of health factor for a substantial portion of the variation in years of potential life lost in both counties. The influence of the causal domino effect, of how different factors influenced each other for social determinants of health was prevalent. A statistically positive correlation exists between the findings, and the findings regarding the relationship between external and internal death are promising. However, the data needs more models. The findings underscore the importance of addressing social determinants of health policies and practices and narrow the life expectancy, thereby reinforcing the profound implication on research. There are several areas for additional research. These areas include further testing on the conceptual model and methodology in different areas of the country, testing the model on 3 or more settings simultaneously, and additional research on hereditary genetics and lifestyle co-founders. This concludes my presentation for today. If you would like to ask me any questions or reach out to me, please do. I'd be more than happy to sit down with you and discuss these results in more detail and answer any questions that you have. Thank you very much. Hereditary longevity